यूएस में मेडिकल एजुकेशन कैसे होता है? यूएस के डॉक्टर्स कैसे प्रैक्टिस करते हैं? वो अपने पेशेंट्स को कैसे ट्रीट करते हैं एज कंपेयर टू इंडियन डॉक्टर्स? यूएस के डॉक्टर्स का सैलरी कितना होता है? यूएस में डॉक्टर्स का वर्क लाइफ बैलेंस कैसे होता है? ये सब हम जानेंगे इस एपिसोड में थ्रू आवर स्पेशल गेस्ट। और उनकी स्टोरी स्पेशल भी इसलिए है क्योंकि उन्होंने भी पहले डिसाइड नहीं किया था कि उनको यूएस जाना है। उनके मेडिकल एजुकेशन में जैसे जैसे वो आगे बढ़ते गए वैसे वैसे उनका डिसीजन फर्म होता गया कि यूएस जाके उनको कुछ इंटरेस्टिंग करने मिलेगा। वहाँ पे कैसे एजुकेशन डिफरेंट है, वहाँ पे रिसर्च को कैसे ज़्यादा इम्पोर्टेंस देते हैं और वहाँ से हम क्या सीख सकते हैं। क्या इंडिया में भी रिसर्च को इम्पोर्टेंस देते हैं? ये सब हम जानेंगे इस एपिसोड में। एंड मजे की बात यह है कि वो कोई टॉप कॉलेजेस में से नहीं है, फिर भी उनकी क्यूरियोसिटी को यूज करके उन्होंने ऐसे एक्टिविटीज और ऐसे स्टेप्स लिए हैं जिसके वजह से उनका एप्लीकेशन प्रोसेस काफी स्मूथ हुआ है और उन्होंने जो भी हर्डल्स आए हैं उनको पार किए हैं। ये एपिसोड एंड तक देखिए क्योंकि आपको बहुत मजा आने वाला है, क्योंकि आज हम यूएस के और इंडिया के मेडिकल सिस्टम को कंपेयर करने वाले हैं। Do like, share, and subscribe. And please welcome Dr. Advait Joshi.
uh, let's discuss about the USMLE process in detail.
Um, Now, step one basically consists of all the basic science subjects like there's patho, pharmac, micro, immunology, public health sciences, psychiatry, and then you have also system-based subjects like you have cardiology, neurology, renal system, respiratory system, all I mean, okay, heme oncology, stuff like that. uh, but like and the way you would prepare, like if a second year is preparing for step one, it would be actually very different experience for them as compared to someone if a final year or someone who's finished their final year, like a post MBBS or a person from their internship is approaching that exam.
Yeah, I mean, as in, it was like a little bit counterintuitive कि भाई जिसका सेकेंड ईयर खत्म हुआ है उसके सेकेंड ईयर फर्स्ट ईयर सेकेंड ईयर के सब्जेक्ट्स एकदम फ्रेश रहते हैं, तो मतलब यूजुअली वो देना इजी होना चाहिए, बट दिस इज लाइक एन इंटरेस्टिंग पर्सपेक्टिव कि अरे बाबा, आफ्टर यू लाइक गिव योर फाइनल ईयर थर्ड ईयर तो उसके बाद यू आर सेइंग दैट इट इज इजियर, तो व्हाई इज दैट द केस?
सो मतलब बेसिकली कैसा होता है कि जब भी हम लोग फर्स्ट और सेकेंड ईयर में होते हैं ना, तभी वी आर लुकिंग एट लाइक द वे इट इज taught in MBBS, right? And anatomy, when you're learning anatomy, a really complete anatomist is teaching you anatomy, so they are really giving you information from their perspective. Like they're kind of giving you a trailer of what anatomist, if you in the future become an anatomist, I don't know if that's a word, but yeah, like then how would it be like? Or if you are a pathologist or a pharmacologist, or I mean, you're literally being grilled into pure theoretical subjects or pure even practical, like very minimal practicals are there in both these in first and second year, except the dissection part. I mean, there's a big dissection chunk, of course. But मतलब अभी तो कैसा होता है कि जो सेकेंड ईयर जस्ट फ्रेशली ग्रेजुएटेड सेकेंड ईयर होता है ना, उसको लगता है कि हाँ, अभी एंटी अरिथमेटिक ड्रग्स इज एंटी अरिथमेटिक ड्रग्स, इट इज नॉट रियली कनेक्टेड टू एंड अरिथमिया। और अरिथमिया तो सीखा ही नहीं होता है, मतलब अरिथमिया तो सीखना होता है फाइनल ईयर में। एंड सो arrhythmia to chodo, but even like basics like compliance, lung compliance that we hear in physiology, that concept never comes back in second year. So you're left wondering, अरे lung compliance पढ़ा हमने, what was the use of that, you know? So we go like second year graduates take it from a very subject to subject basis. So and they don't learn to connect subjects, like they don't learn how to connect anatomy with them. Like for example, I'll give you a good example, right? इन फर्स्ट ईयर जब हम लोग सब फर्स्ट ईयर में थे, सबसे हार्डेस्ट सब्जेक्ट बताए क्या था? सबसे हार्डेस्ट सब्जेक्ट, इट वाज नॉट anatomy, it was not physiology, it was not biochemistry. The hardest subject in MBBS or first year, I would say, is embryology. एम्ब्रियोलॉजी
एम्ब्रियोलॉजी।
इतना इमेजिनेटिव है, क्या मालूम क्या हो रहा है, वो ट्विस्टिंग हो रहा है गट का, तो एओर्टा कैसा फॉर्म हो रहा है, हम लोगों को क्या फर्क पड़ता है? लाइक मेरा हमेशा क्वेश्चन था अबाउट एम्ब्रियोलॉजी, कि हाँ भाई अभी ऐसा हार्ट बन रहा है, मुझे क्या फर्क पड़ता है? लाइक मैं तो एक अडल्ट पेशेंट को ट्रीट करने वाला हूँ, व्हाट डू आई केयर अबाउट एम्ब्रियोलॉजी?
Okay, so
बिकॉज
interesting question.
या
What is the, now since you have been there, what is the earning of like say an internal medicine doctor there per
हम्म
annum?
हम्म internal medicine doctor depends on where you are working and what you are working in and what kind of institution you are working in. I can say a resident uh, is paid about 60,000 to $70,000 in that range. It might be a little 10,000 plus minus either way. Um, Beyond that, I am not very sure how it proceeds actually, the cost of living. Because the thing is, what you have to realize is that a lot of this depends on what kind of institution you are at. Like let's say you are in a very academic institute, like a very academic, like let's say I'll not take names, but let's say some Ivy League in the US, right? Your salary won't be that much. I mean, it and also depends on what kind of specialty you are in. Like you are in some niche specialty, maybe your salary will be very high. If you're in a very common specialty, your salary might not be that high. Because a lot of these Ivy Leagues, they're not concentrating on money making. They're concentrating on research. The
Research, yeah.
funding comes from research, and like government funds them very well, and their main objective is to do something else, not to earn money. If you are like a private clinic, you have your own private practice in the US, then yeah, you will be making a lot more money. You'll be making something like in three figures basically, 200, 300. I have heard that in Florida, if you have a private clinic, then you are kind of on beyond 500,000 as well. Like your
Beyond, I'm
salary
sorry.
beyond $500,000, I've heard.
Okay, beyond 500,000. Okay. So
Um,
like इंडिया में कन्वर्ट किया तो 4 करोड़ रुपया साल का।
हाँ मतलब 500 into 100 जिनको भी आता है अभी कैलकुलेशन वो कर सकता है. So
रफली
हाँ
अराउंड 4-5 करोड़ मिलेगा। ओके।
हाँ but
वो तो है।
again, हाँ मतलब the thing is, yeah, I mean, if your aim is to make money, then sure, it's like uh, that's one choice. But I'll also tell this to you very plainly. Huh? US system is not easy. It is a very hard system to get acquainted to. It is something that you have to practice to get acquainted to. It is not like the Indian system where अभी तुम लोग को drugs याद हो गए, तुमको ये याद हो गया, how to treat a patient, I mean how to which test to diagnose, so you start writing it down. उन लोग का जो इलेक्ट्रॉनिक मेडिकल रिकॉर्ड सिस्टम है, if you're not used to uh, working on it basically, then it requires practice. One thing is that, and the entire system is very convoluted, so you have to sort of understand. अभी अभी मैं सबको एग्जांपल दे सकता हूँ. अभी कोई रेसिडेंट देख रहा होगा ये वीडियो, तो उन लोगों को पता ही होगा कि इंडिया में हॉस्पिटल में कॉल भेजना पड़ता है. मतलब
हम्म।
लेट्स से यू आर इन आईसीयू, उन लोग को चेस्ट एक्सरे के लिए कॉल भेजना पड़ता है. तो यूएस में यू हैव टू, देर आर लाइक और ज्यादा कॉन्वोल्यूटेड है, मतलब इतना इजी नहीं होता है. मतलब होता है उनका भी कुछ तो अलग सा सिस्टम होता है, फॉलो करना पड़ता है वो बैठ के. एंड इट टेक्स अ वाइल टू लर्न ऑल ऑफ दैट, एंड इट टेक्स अ वाइल टू लर्न द सिस्टम एज वेल. लाइक उन लोगों का जो कंप्यूटर का सिस्टम है, बिकॉज लेट्स से यू आर एट
राइट।
a good Ivy League, you might have something known as an EPIC. It is basically a electronic medical record program. It's a very nice
ओके।
program. If you're at a institute which does not have a lot of funding, they will have a cheaper kind of a more cheap sort of a like I've seen clinics, they use practice fusion करके ये होता है. I don't even know if they're cheap or not अभी मैं, but I have heard that they're cheap sort of. So वो system अलग है. Then so basically if you are skipping from one institute to another, you have to keep learning अलग systems from time to time. But that's also true in India. I mean, if you go from Fortis to uh, uh, कोई और हॉस्पिटल, वॉकहार्ट हॉस्पिटल, I'm sure the systems will be completely different here and there to relearn everything again.
So I think that is the reason people might go there, कि वहाँ पे एक तो स्टैंडर्ड ऑफ लिविंग अच्छा है, you earn good money as a doctor, and I am guessing now that is something you are going to tell me कि वहाँ पे how is the work life balance?
So, depends on, again, I mean, ये question actually misleading question है बहुत. लोग बोलते हैं work life balance अच्छा है, ऐसा नहीं है. You have to work, you have to struggle. If you're a first generation immigrant, person who's going there for the first time, there's no mom and dad there for you. You have to work your ass off. Even as, like I've been with private practitioners in Detroit. They work their ass off every day. Like they come at 8 a.m. in the morning, they leave by 5, 6 p.m. But they see a lot of cases. They have to run from one clinic to the other because all patients are waiting for them. The appointment time for one patient to come in is already very late. Like it takes maybe 20 days, 30 days, 40 days, 50 days, 60 days, 70 days,
Mm-hmm.
depending on how many patients, how popular you are also. So that's one thing. So as a first generation immigrant, anywhere in the world, okay, like you go to Germany, you go to England, you go to Australia, anywhere, UK, anywhere in the world, you have to work your ass off. You have to be ready to work your ass off. And so, I mean, the mentality that people have कि इंडिया में बहुत काम है तो मैं यूएस चला जाऊंगा, ये नहीं चलेगा. नो, ये नहीं चलेगा, ये मिसलीडिंग है. जो भी बोलता है कि वर्क लाइफ बैलेंस है, दे आर टॉकिंग दैट yes, there will be there won't be like, they won't make you work like 4 days in one go. They will give you maybe a rest for the night. They might not also give you rest for the night during residency. Depends on where you do your residency. If you do it in New York, let's say, it might be possible that you will be working probably as hard as you are working in Mumbai. So I mean, it depends basically. If you're in a very IMG friendly place, it's possible that you will be working very, very hard because most of them will be IMG. I mean, they all know how hard IMG works and sort of. So, ऐसा मेरे को, at least जिधर भी मैं गया, मुझे ऐसा लगा कि people were giving their, like, sweating and just giving everything. I'll give you a good example. One more, like at Harvard, I met a guy. He's an American born. He's a second, third generation, I think, American. I'm not sure. He's not from India. He's like, his parents are from some other country. But what he told me is that um, what Americans love is a work-life balance. Can you hear me? Yeah. So what
Yeah, yeah, yeah.
Americans love is a work-life balance, but for him, his life is his work. So he has work balance. So he actually works probably the most hardest in that. Maybe that's a fair or unfair thing to say. But what I'm trying to say is that he works very hard. Like I have seen him on Sundays. I used to go on Sundays. He used to come on Sundays. He used to come on Saturdays. I used to stay in that institute till 6 p.m., 7 p.m. He used to be there at 6 p.m., 7 p.m., looking up patients, seeing patients, talking to them. And you have to realize that ठीक है, patients कम होते हैं. मतलब, let's say India में you are managing 100, 120 patients a day. Let's say, I mean, good figure, 100, at least 100, 120 तो होगा easily. I mean, overall, IPD plus OPD, maybe more than that also, in a government institute in India. Maybe the number of patients that you're handling is less in the US, but you will give a lot of time to each patient. Like I have
Right.
seen a professor give, like in MGH in Harvard, I have seen a professor give 72 minutes to one patient. 72 minutes. I was measuring because I was like, oh damn, like I have never seen this quality of healthcare before. Like इतना हर एक डाउट सॉल्व करो, हर एक स्टैटिस्टिक्स बताओ, हर एक पेपर को साइट करो.
In यहाँ का post graduation versus वहाँ का post graduation, and what made you choose, what made you think कि अरे भाई वहाँ पे जाके कुछ मतलब interesting होगा?
सो तो कैसा था कि जब भी मैं माइमर में था, तभी एक्चुअली लॉट ऑफ थिंग्स टूक इट, मतलब ऐसा वो स्पॉन्टेनियस कॉन्शियस डिसीजन नहीं था कि हाँ मुझे अभी यूएसएमएल करने का है। मैं बोलता था लोगों को मैं भी यूएसएमएल करूंगा करूंगा, लेकिन एक्चुअली इनसाइड माय ब्रेन आई वाज जस्ट थिंकिंग कि इज यूएसएमएल वर्थ इट, इज गोइंग आउट ऑफ द कंट्री वर्थ इट, इज
हम्म
इट रियली like is it my dream to sort of settle in the US? ऐसे वो conscious questions होते थे मेरे, and I just said that I will just go with the flow and see where life takes me, and then just follow my passion basically. And then eventually I took up the USMLE route. So I'll give an example. When I was in first year, I had a very close friend, a close senior who became a very good friend of mine. I don't know. Do you know Awais Faruqi? He
yeah
was
I
from
know it.
Budi.
Yeah.
Yeah, yeah. So he's a good friend. He used to teach me a lot of. At that time, I still remember he taught me fetal circulation, basically how the placenta से आता है blood. And उसने तभी मेरे को at that moment he had told me about indomethacin करके ड्रग होता है, about patent ductus arteriosus के बारे में बता रहा था उनको, how prostaglandins play a role. And ये सब किधर नहीं लिखा है फर्स्ट ईयर में, ये सब तो सेकेंड ईयर में पढ़ाता है. सो एट दैट टाइम आई रियलाइज कि हाँ मतलब जब भी मैं सेकेंड ईयर में आया ना तभी मुझे ऐसा लगा कि आई शुड sort of start फाइंडिंग आउट थिंग्स विच आई कैन रीड इन डेप्थ. तो अभी बहुत छोटा था मैं तभी, बहुत स्पॉन्टेनियसली मैंने बोला कि अभी सब लोग एवरीवन स्टार्टेड प्रिपेयरिंग फॉर नीट. ओके, एवरीवन जॉइंड डैम्स, एवरीवन जॉइंड भाटिया. एंड तभी मैरो आया नहीं था. मैरो वाज नॉट ऑनलाइन मीडिया, वाज नॉट अ थिंग येट, इट वाज एन ऑफलाइन मीडिया दैट टाइम. सो आई वाज लाइक नहीं मैं तो नहीं करूंगा ऐसा कुछ. I will stick to books, but I will also join something which will help me. So I joined Dr. Najib. He's the he's a Pakistani professor, but he teaches a lot of basic sciences, information from a point of view of medicine. मतलब वो बहुत in depth जाता है, but वो मतलब ठीक है. मतलब मुझे लगता है at one point you will also forget a lot of information that he gives, but जो भी information देता है वो at that moment पढ़ने के लिए मजा आता है. And that fun is very unique, that you don't get to learn that in coaching classes where they focus only on things that have previously been asked. वो कुछ भी बोलता था, मतलब he will talk about HIV, history of HIV, history of blood pressure, ऐसा सब. मतलब फन वीडियोस थे उसके बहुत. तो ये सेकेंड ईयर में मैंने उसका सब्सक्रिप्शन लिया था डॉक्टर नजीब का. एंड देन वहां से मेरे को पता चला कि हाँ यूएसएमएलई करके एक एग्जाम होता है. मतलब डॉक्टर नजीब इज एक्चुअली a guy who which I found out later that he is teaching his curriculum for USMLE. तो
Okay.
फिर I joined then I मतलब तभी यूएसएमएलई के बारे में पता चला तो मेरे को लगा कि अरे यूएसएमएलई में तो इतना डेप्थ में सिखाते हैं चीजें, तो आई शुड स्टडी फॉर दिस एग्जाम. इट माइट मेक मी अ गुड डॉक्टर. ऐसा मेरा तभी का ओपिनियन था कि let these people join Bhatia dams, I will go and join something else, something that I like, something which will make me explore. So then I joined this thing called Becker's, and I tried it. I tried very hard during my second year to study from Becker's. I just couldn't do it at that time. It was either you can say मतलब वैसा बोल सकते हो कि मेरा माइंड ही बहुत इमेच्योर था, कि मेरे कंसेप्ट ही बहुत सारे वीक थे, और मुझे प्रॉब्ली पूरा मेडिसिन का एक्सपोजर नहीं था. पता नहीं, इट कुड बी माई फॉल्ट, इट कुड बी ऑल्सो दैट वो कंटेंट ही बहुत बोरिंग था. ऐसा भी बोल सकते हो. तो मेरे को नहीं अच्छा लगा. तो फिर मैं देन आई जस्ट स्टक टू सेकेंड ईयर, एंड देन व्हेन आई केम टू थर्ड ईयर आई रियलाइज दैट थर्ड ईयर में तभी कैसा होता था, अभी पूरा चेंज हो गया करिकुलम, बट तभी इट वाज समथिंग लाइक यू मस्ट हैव आल्सो गॉन थ्रू दिस, आई डोंट नो. थर्ड ईयर के फर्स्ट सेमेस्टर में यू हैड टू डू some parts of final year subjects, like you had to do general pediatrics, general orthopedics, general surgery. You had to do parts of medicine like infectious, hematology. तभी hematology मतलब anemia होता था, मतलब basically just some sort of an iron deficiency anemia or vitamin B12 deficiency बस. और मैंने तभी बहुत सीरियसली लिया था. मतलब बाकी के सब लोग टाइम पास करते थे, मैं थोड़ा सा अलग से पढ़ता था थर्ड ईयर में फाइनल की चीज़ें. एंड ऐसा करके फिर थर्ड ईयर में आई रियलाइज दैट व्हाट मेडिसिन आई सॉर्ट ऑफ स्टार्टेड हिंटिंग दैट ओ माय गॉड, सो वॉट एवर वी आर रीडिंग, मतलब जो भी हम लोग फर्स्ट ईयर सेकेंड ईयर में पढ़ रहे, इट इज ऑल कल्मिनेटिंग एट सम पॉइंट. एंड just giving you a bigger perspective of what medicine is. So third year is what I like to say is where my MBBS truly began, because that is where I started to solidify my first and second year subjects, and again actually start learning my final year subjects. But still, I will also say that till the end of final year, till the end of third year, I did not like medicine. I kind of hated it to a point. It was like a very opposite spectrum. And final year, COVID hit,
हाँ हाँ
and it
हाँ
gave me so much time to sit and study medicine from so many different resources. And the thing is, because of COVID, no, I was not in Talegaon. I was in Mumbai. एंड सो मेरा क्राउड जो था, मतलब मेरा जो सर्कल ऑफ फ्रेंड्स चेंज्ड इन फ्रॉम व्हेन आई केम बैक टू मुंबई. It became all the friends that I had back in 11th and 12th who had joined medical school in Mumbai or somewhere else. They became my friends again, and I started learning from them. I started learning from their colleges. I used to चुपके से attend KM के lectures और science के lectures, क्योंकि online में क्या फर्क पड़ता है, कोई कौन देखने नहीं वाला, एम्स के
राइट
lectures. And then there was this professor or his teacher, not a professor. His name is Dr. Sushant Shinde. He's a AIMS ka doctor, and he taught medicine from a non-exam perspective. मतलब पूरा ऐसा medicine, मतलब you will fall in love with medicine, but you might not be able to crack an exam with those classes. ऐसा kind of था. उसने वो free किया था lectures कोविड के समय. तो मैं वो देखता था, तो I sort of started loving medicine at that time. I would say I started loving neurology actually at that time. Neurology was the first thing that I fell in love with
ओके
because of him. And then I joined other professors as well. ऐसा मतलब थोड़ा सा culminate होके basically पता चला कि USMLE makes you think, basically. I had a lot of peers from Sion and KM who influenced me basically कि यूएसएमएलई तुम करोगे तो तुमको ऐसा अच्छा लगेगा, मतलब इट विल गिव यू अ थॉट प्रोसेस टू थिंक ओवर एंड सॉर्ट ऑफ it is not just solving random questions and getting marks or getting a rank. It is about sitting at each question, thinking about that. It's like, if you look at any question of USMLE, it is like basically a real life case. You have to think about differential diagnosis, you have to think about management, you have to think about, I mean, step one में ऐसा सब नहीं है, step two में ऐसा है कि you have to think about an actual, like your each case is, each question is a case, or you can say each question is a patient. And so how will you think about it? So it gives you a very nice structural way of thinking. So उसके लिए मैंने USMLE pursue, मतलब I sort of went in that flow, ऐसा मैं बोलूँगा. It was not like pre-decided कि मतलब conscious decision नहीं था कि मैं बैठ के प्लान किया कि हाँ मैं अभी इस दिन से USMLE शुरू करूँगा, sort of. ऐसा ऐसा नहीं था मेरा. It was more like uh, let me see where the flow takes me, and then I will decide as per that, basically. And so, to be honest, like even in my internship, I was not very completely sure that I will go to the US. Like uh, the reason that I took a transfer from Myanmar to Sion was to actually explore Indian healthcare system from a government's perspective. And
राइट
then actually when I came to Sion, I realized, wow, मतलब केसेस तो बहुत सारे देखने को मिलते हैं इधर. द ओनली प्रॉब्लम इज कि ठीक है, मतलब प्रॉब्लम नहीं बोलूंगा, इस तरह से देयर आर टू मेनी केसेस एंड वेरी फ्यू डॉक्टर्स, सो टाइम गिवन पर पेशेंट इज काइंड ऑफ लेस समटाइम्स.
तो कंस्ट्रेंट उसमें आ ही जाता है यार राइट आई मीन लाइक
या
इतने सारे पेशेंट्स हैं लाइक इफ यू रियली गो इनटू द इंडियन हेल्थ केयर सिस्टम एट द ग्रास रूट लेवल तो
राइट.
मतलब यू गेट टू सी अ लॉट ऑफ केसेस बट देन टू सिट एंड डिस्कस अबाउट वन केस या वन पर्टिकुलर ऐसा रेयर केस तो वो
राइट.
उतना टाइम नहीं है
एग्जैक्टली. बट हाँ मतलब, सो आई वुड से दैट मतलब आई विल नॉट say that this is a disadvantage also. Think it from a doctor's perspective that हम लोगों को कितना सीखने को मिलता है, हम लोगों को कितना चाय का ब्रेक मिलता है, हम लोगों को कितना पैसा मिलता है. But if you look at it from a patient's perspective, they are getting treated at the end of the day. They are walking out, they're going home. Uh, they are, like poorest of the poor people get treated and sort of, I
एब्सोल्युटली
mean, it,
वो तो है
yeah, so वो तो है. तो मतलब वो भी पर्सपेक्टिव देखने को मिला मेरे को सायन में। एंड द थिंग इज आई रियलाइज्ड, सो बेसिकली इन सायन सब किया मैंने, बहुत सीरियसली किया इंटर्नशिप मैंने। मुझे तभी किसी ने बोला नहीं, मतलब मेरे को बहुत बाद में पता चला कि एक्चुअली पीडियाट सायन में देयर इज एन अडल्ट हीमेटो ऑन्कोलॉजी क्लिनिक आल्सो, व्हिच आई डिड नॉट नो एट दैट टाइम, क्योंकि इतना बड़ा हॉस्पिटल है वो, अभी किसको ढूंढ के बैठूं मैं।
हम्म।
तो और किसी ने बोला भी नहीं मेरे को ऐसा है। तो फिर बाद में फिर देन आई मेड अ कॉन्शियस डिसीजन कि यू नो व्हाट, आई विल जस्ट टेक अ ब्रेक फ्रॉम माय इंटर्नशिप एंड आई विल गो टू टाटा, बिकॉज टाटा तो सबको नोन है, इट इज अ कैंसर इंस्टीट्यूट ऑफ मुंबई एंड वेरी फेमस। सो आई वेंट देयर। So when I initially applied, they told me I am too young actually. Like I am not qualified enough to, like, you
ओके।
know, like I sort of go to the, but India mein observership is basically like you go and work there sort of. But anyway, so उधर में गया। मुझे मुझे लगा कि एटलीस्ट ट्राई करते हैं, ज्यादा से ज्यादा मना कर देंगे, क्या क्या फर्क पड़ता है। एंड सो दे पुट मी इन पैथोलॉजी एक्चुअली। पर पैथोलॉजी तो मतलब मुझे इंटरेस्ट नहीं था, तो उससे अच्छा फिर मैं साइंस में जाऊंगा वापस। But before going, had a word with the director of that, or whatever observership program or whatever. And then he's like, "Wait, I didn't put you in pathology. You should go if you really like adult hematology. You should go and work with them." I'm like, "Oh, okay, I would like to go and work with them." So that is how, मतलब basically ये सब administrative में ही problems होता है. If you go and actually talk to professors and you actually go and talk to in you know attendings and all, कोई मना नहीं करने वाला है उन लोग को। तुम लोग डायरेक्टली जाके बात करोगे तो उन लोग हाई बोलते हैं 99% ऑफ द टाइम। सो दिस इज एग्जैक्टली व्हाट हैपेंड विथ मी। द डायरेक्टर ऑफ द program allowed me to go and rotate with Tata. And फिर मुझे India's best health, like Tata is literally I would say, जितना मैं एक्सप्लोर किया था तब तक, लाइक माइमर एक्सप्लोर किया था, साइन एक्सप्लोर किया था, फिर टाटा जब भी मैं घुसा तभी मेरे को लगा ओ माय गॉड क्या मस्त इंस्टीट्यूट है। बिकॉज यू गेट, आई मीन आई विल से टाटा एंड केईएम आर राइट ऑपोजिट ईच अदर, ओके, लाइक वन गवर्नमेंट
हम्म।
इंस्टीट्यूट एंड देयर इज टाटा, and both get exactly the same number of patients, and the doctor to patient ratio is also exactly the same. Like you have doctors very less here and doctors very less here. There are a lot of patients on both sides, but the way Tata treats each patient, it is so thorough and it is so systematic, and like it is very wonderful, and it is not only clinical. They're very very research driven. They use a lot of evidence based practice. When I say evidence based, मतलब ये कुछ लोग बुक्स को कोट नहीं करते हैं, हैरिसन में ऐसा लिखा है, लोग लिटरली पेपर को कोट करते हैं, लाइक डीओआई बताते हैं, क्लिनिकल ट्रायल एंड सो ऑन, एंड वी हैड दीज रिजल्ट्स। लाइक द बेस्ट एग्जांपल दैट आई कैन गिव इज द Rasburi case ka example, where there was a patient who had tumor lysis syndrome, and uh, the actual dose of giving a Rasburi case is something I think 0.2 milligram per kg per day or something like that. And Rasburi case is a very costly drug for Indian market. I mean, for Indian patients, like people coming from Dharavi and these very low socioeconomic background, sort of, they cannot afford Rasburi case like that. तो इन लोगों ने खुद का एक क्लिनिकल ट्रायल किया अंदर ही कुछ तो, एंड दे रियलाइज दे फिक्स द डोज ऑफ रासपुरी केस टू अ सर्टेन वैल्यू। सो नो मैटर व्हाट द वेट इज, नो मैटर व्हाट द एज इज, नो मैटर कितना दिन है, वो उतना पर्टिकुलर डोज रासपुरी के इज इनफ टू ट्रीट दैट पेशेंट। उन लोगों का खुद का ट्रायल है, फॉर एग्जाम्पल दे डिड दैट इन देयर ओन। तो ऐसा सब देखने को मिला मेरे को वहाँ पे, एंड आई वाज वेरी वेरी इंट्रीग्ड, लाइक ऐसा भी होता है इंडिया में, मेरे को फर्स्ट टाइम रियलाइज हुआ। सो दैट इज व्हेन आई रियलाइज दैट व्हेन पीपल से कि इंडिया में रिसर्च नहीं होता है ना, आई रियलाइज दे हैव नो आइडिया व्हाट दे आर टॉकिंग अबाउट। लाइक इंडिया में रिसर्च होता है, बहुत रिसर्च होता है, इट्स जस्ट दैट आपको एक्सपोजर नहीं है ना। ऐसा प्रॉब्लम है। सो मुझे बहुत इंटरेस्टिंग लगा। सो या, तो दैट इज व्हाट आई वुड से। फिर वहां से फिर आई गॉट अपॉर्चुनिटीज टू गो अब्रॉड, आई वेंट अब्रॉड, सो उधर का सिस्टम्स, एंड आई वुड से वेरी simple, like at least I went to Harvard, for example. So Harvard and Tata are very much comparable. Like the of course Harvard में very less number of patients come, and obviously the doctor and patient ratio is kind of equal. It's not haywire like Tata. So like that kind of terms, you can say that, a doctor is able to give 20 minutes, 30 minutes to a single patient, have a proper conversation with them. But in terms of quality of healthcare, I would say both are kind of comparable. They're kind of
Wow.
comparable. So
I
I
mean,
sort of realized, yeah.
yeah,
So
this is
I
like
sort of
mind boggling क्योंकि one would imagine कि अरे यार हार्वर्ड इज हार्वर्ड, वो कहाँ वर्ल्ड
yeah,
क्लास
of course.
उसका अ,
I mean, उनका
जो भी
फंडिंग
रहेगा।
है, उनका ये है, उनका
हाँ
है, लेकिन मतलब मैं बोल रहा हूँ कि फंडिंग का इशू के मतलब if you take everything into account, if you control everything like they say in research, if you control everything, then I think Tata is very much comparable to Harvard or any
हाँ
Ivy
मतलब
League in
फंडिंग फंडिंग इफ यू लाइक इफ यू एडजस्ट फॉर फंडिंग पैरिटी को अगर हम
yeah,
लोग कंसिडर करेंगे तो फिर
right,
टाटा इज अप देयर
really.
विथ हार्वर्ड एंड
I
स्टफ।
would say, yeah, easily. I would easily say that. So I loved it. I mean, it was amazing. I mean, मैं देखो, मैं इतना भी बोलता हूँ, सब सब लोग इतना भी बोलूंगा कि I had so many instances in when I was at Tata where I just didn't मतलब इतना कॉम्प्लिकेटेड केसेस आते थे, कभी मुझे तो कुछ समझ में भी नहीं आता था, सम ऑफ द केसेस आए, सम ऑफ द डायग्नोसिस, some of the stuff that they used to ask me sometimes were just that small tiny amount of growth within you. It is a different feeling, to be honest. And फिर मतलब फिर उसके बाद मैं हार्वर्ड गया, फिर हार्वर्ड में एक्सप्लोर किया। उधर का सिस्टम में के बारे में बात कर सकते हैं, उधर का तो I mean, of course, Harvard was a part of my route. Like now that I had actually joined Tata after I finished my step one. So I joined Tata at about, I think, December of 2022, and had given my step one in July of 2022. So मेरा first and second year का sort of all the nitty-gritty stuff, all the B cells, T cells, उनका खुद का cancers was pretty much clear, and तो मुझे काफी enjoy भी हुआ टाटा में जाके। Awesome thing that I realized was that how much मतलब टाटा में भी एक्सपोजर हुआ मेरे को, थोड़ा briefly हुआ, because I was only there for like a very short period, like I was only there for 2 to 3 weeks, I think. So I went to LTMMC, then I finished my step one by July of 2022. Then in November, I actually did a tele. So तभी ऐसा सीन था कि कोविड का थर्ड वेव आके गया था, सेकंड वेव आके गया था, मेरे को याद नहीं है, लेकिन तभी यूएस के वीसा सारे क्लोज थे, मतलब इंडिया में यूएस का
हम्म।
वीसा वाज अ बिग इशू। तो और मेरा वीसा एक्सपायर हो गया था एट दैट टाइम, सो आई नॉट एबल टू बुक अ फ्लाइट और एवर लाइक गो टू द यूएस एट ऑल। And if you wanted an US visa interview urgently at that time, so you would need a acceptance letter from a university. तो वो तो नहीं मिला था मेरे को तभी तक, कोई भी electives के लिए। So then I did a tele rotation, मतलब I used to attend a clinic in the US through Zoom, and I chose this in hemato-oncology because of again science. So pediatrics hemato-oncology पहले किया, फिर ब्रुकलिन यूएससी करके, ब्रुकलिन कैंसर केयर करके एक जगह है न्यूयॉर्क में, उनके साथ टेली रोटेशन किया। फिर उसके बाद मुझे लगा कि अभी इंडिया में थोड़ा एक्सप्लोर करना चाहिए, तो मैं टाटा में गया। फिर टाटा में मेरे को एक्चुअली एक लेटर और रिकमेंडेशन भी दिया उन लोगों ने वहाँ पे, तो थोड़ा अच्छा लगा मेरे को। वो बहुत मदद हुआ मेरे को एक्चुअली उनका, कि बिकॉज टाटा इज अ वेरी वेल नोन नेम इंटरनेशनली। Like if you say that you've been to Tata, Harvard ki people recognize Tata. Like it is that well known. So when you tell people, that I have been to Tata, I've worked there for two weeks, I've seen how things are, how research is, they take you pretty seriously and they ask questions to you about that. So when I applied to Harvard, the professor that I was working under, she had been to Tata. So
ओह
it was interesting. So yeah, so ऐसा सब होता है basically. So the things that you do start helping you at some point in your journey, and which you might not even मतलब मैं तो गया टाटा में एक्सप्लोर करने को, मुझे तो मालूम ही नहीं था कि it will help me later or not basically, but it helped me. And so that is when I realized that a lot of these decisions should have मतलब had I taken these decisions earlier in my MBBS, like let's say first year, second year, when you have a lot of time, like third year, fourth year, fifth year in your internship, I think it's time to get a little serious. That I took it a little too casually, I feel. But other people should take it a little, like, first year, second year में तुम लोग explore करो यार, तुम लोग को इतना time है करने को explore. Third year में थोड़े serious हो जाओ, fourth में और serious हो जाओ, fifth year में try to get a residency as soon as possible or whatever you want to do. But yeah, I mean, something like that basically. So yeah, then I went to the US. I did a lot of stuff in the US. I went to one private clinic, then I went to another private clinic. One was in the two were in New York. One was in cardiology. The tele-rotation that I had done, I went on site and actually saw cases over there. Then I went to, so actually, because my main institute, Mimer, is in Talegaon, which is like, I would say, I would not call Talegaon rural at all, but just because it's on paper, it's a rural medical college, I will say, yeah, it is a rural. I wanted to explore something similar in the US because everyone will go to New York, yeah, everyone will go to Chicago, everyone will say, yeah, US to बहुत अच्छा place है. So I wanted to go and see a rural healthcare setup in the US. So I went to this small town in Illinois. It's like a तलेगांव को divide करेंगे उतना छोटा गांव है वो.
So,
हाँ.
Illinois, like, how did you decide to go to like rural America?
हाँ, so
As
वही
in,
मतलब मुझे ऐसा क्यूरियस था, मतलब एक्चुअली क्यूरियस भी नहीं था. आई वॉज डेस्परेट ऐसा भी बोल सकते हैं हम. आई वांटेड क्लिनिकल एक्सपोजर समवेयर एंड आई ऑल्सो मतलब that was there. Plus, I also had that, I wanted to do, I had my own goals. I want to go to the US का rural place at least once in my life. अब वो opportunity दिखा तो मैं apply किया वहाँ पे, and I did not even know कि वो select होऊंगा. So I was on LinkedIn one day just looking for opportunities, and I saw one random post say that we are giving a clinical electives slash clinical externship opportunity for medical students for free. Uh, and all you need to do is submit your CV. You have to submit your personal statement, I think, and an application to whatever. तो scam भी हो सकता था at that time, but मैंने तो कर दिया. तो भी मैं बोला करने में क्या जाता है, देखते हैं होता है तो होता है. And then they were one of the first people to tell me that I have been accepted. But it is in Decatur, and how will I come there? ऐसा था क्योंकि a lot of people must have been accepted, but maybe a lot of people didn't want to go to Decatur. Probably it's possible. I don't know. Or couldn't go. Maybe it was just too. Well, it is like literally अगर तुम लोग तळेगाव को literally break करोगे उतना छोटा गांव है वो, and it has its own airport also. It's very fascinating actually. So I had gone there in I think in April of 2023 for 1 month. Very interesting experience. Very, very small. Everyone knows everyone in that town. It is that small. And it was very nice, very fun experience. I met some of the most loveliest people. It is so small, लेकिन US में तुम लोग जब भी जाओगे तभी रियलाइज करोगे कि उधर पे ना ऐसा कुछ अपने जैसा किधर भी जाओगे तो एटलीस्ट देयर विल बी रिक्शा, देयर विल बी some mode of transport that you can sort of use. In the US, if you look at Chicago and New York को छोड़ के, if you go as interior as you go, मोड ऑफ ट्रांसपोर्ट कम होता है. ट्रेन भी नहीं है वहाँ पे जाने के लिए, ऐसा होता है. तो इफ यू हैव टू गो समवेयर, ईदर यू गो वॉकिंग, यू टेक अ पब्लिक ट्रांसपोर्ट, और यू टेक द कार. मेरे पास तो गाड़ी नहीं था, और पब्लिक ट्रांसपोर्ट से मेरे को तो थोड़ा डर लगता था एक्चुअली, क्योंकि आई मेरा timing of going and coming was kind of odd, and US is a kind of a scary place, to be honest. So I used to feel like, uh, I asked one of the nurses, can she drop me? So the nurse used to drop me and pick me up, and
अरे बाप
very
रे.
nice people. Yeah. Very nice people, basically. So yeah, it was very nice. It was fun. People of Indian origin जो है वहाँ पे, उनके साथ जब भी काम करते हो तभी they usually have walk-in service. They follow the Indian way. They don't give prior appointments. So तभी फिर 100 होता है, मतलब
अरे
100 क्रॉस होता है,
बाप रे.
70, 80, 90, 100 per day almost. Yeah. So it becomes similar to, I would say, Mumbai OPD probably. And then
Amazing.
you see them. I mean, of course, you are helping them and stuff. But in Decatur, for example, we used to have like barely, maybe maximum 20, 30 a day, 30 maximum, I think, at that time. Yeah. But I
Oh,
was also
okay.
in a different, well, it depends on specialty also. I was in gastroenterology. Then we had, I was in New York, I was in hemato-oncology and cardiology. So cardiac cases probably will be much more because obesity बहुत ज़्यादा predominant है वहाँ पे. Uh,
Mm-hmm.
but gastroenterology, colonoscopy, GERD ऐसा सब जो है, I mean, as compared to really heart attacks, it would probably be less. I'm not sure. Not sure of the statistic. Yeah. Yeah.
But so, like you've seen the Indian way of practice, like how specialists and consultants do, and you've seen the US way. So, मतलब difference है कि are they doing something better than what we are doing? या ऐसा कुछ है? Like treatment wise,
Um,
the treatment that patients receive.
so again, it depends on how you look at it. Um, if you look at it from a very disease point of view, then I think we do it better. We diagnose
Oh,
much more quickly than them, just because we have a, we just have seen so many patients. I think you are able to clench the diagnosis much earlier. You're able to set up ultrasound appointments, CT scan appointments, biopsy appointments much faster than the US system. We are able to treat patients faster, provided they don't have a very complicated disease. In that sense, yeah, India is better, definitely. If you look at it from a research centric point of view, where research meets the clinician's eye, ऐसा नहीं बोलूंगा कि इंडिया में इंस्टीट्यूट्स नहीं है ऐसा कि रिसर्च को एम्फेसिस देते हैं, लेकिन बहुत कम है. मतलब मुंबई में वो से टाटा है, एम्स होंगे, PGIMER होगा, मतलब ऐसे सब सेंट्रल इंस्टीट्यूट्स मस्ट बी एग्जैक्टली लाइक प्रोबेबली इक्वल टू द अमेरिकन वे ऑफ टीचिंग. In the US, I felt that again in the US also it depends. It's a very hard question to answer, to be honest, because like I said, there are different kinds of hospitals, and but all of them I would say have a very protocol based approach towards management. मतलब उनका ऐसा होता है कि ऐसा हुआ तो ही मैं ये करूँगा, ये हुआ तो ही मैं वो करूँगा, ऐसा टाइप का होता है उनका बहुत. और वो बहुत रिसर्च सेंट्रिक, मतलब it is done by a lot of studies and they have made that sort of protocols. तो हम लोग का भी एविडेंस बेस्ड होता है, लेकिन हम लोग का एक्सपीरियंस बेस्ड भी बहुत होता है. लाइक
mm-hmm.
some senior doctor will trickle down a dose or not give certain antibiotic or may give antibiotic depending on how they think it has worked for them previously or how it has been taught
In the
to them
past.
previously in the past. US में भी होता है ऐसा, depending on where you are. So for example, if you are in a private clinic in a non-academic setting, then you would be probably treating patients the same way that you were taught in your residency in the US. But if you're in an academic hospital, like let's say you are in a hospital in University of Alabama or University, any of the universities basically, or if you are in any of these major clinics like Cleveland Clinic, or you are in any of these Ivy Leagues, Yale, Harvard, Cornell, they have a very like they have a, they make their own guidelines. I feel. I mean, maybe they follow a larger set of guidelines, but when it comes down to actually treating patients, they have, instead of relying on experience, they actually probably rely more on data out there. And that is what I found interesting. I mean, I want to learn that. I feel it is a very essential skill to learn. And I won't say, I mean, अभी वो viewers के ऊपर है, उनको better क्या लगता है, उनको अच्छा क्या लगता है. I mean, do you want to get treated fast and go home fast, or do you want to be uh, sort of treated the right way? So of course, all of them have to stick to something, because the chances of you getting sued in the US is probably higher than in India. So if someone questions you, why did you make this decision? Then you have to say that because of this.
Third year, second year, या
Right.
even final year, तो तभी
Right.
तक तो वो just वो concepts form होते रहते हैं, and then if you it's just information overload, basically what I'm trying to say.
Right.
And medical field में ऐसा मतलब is just my opinion that you need to memorize a lot. As in there are algorithms on top of algorithms कि ओके ठीक है, ऐसा पेशेंट आया, इसका ब्लड वर्क ये दिख रहा है, so
Mm.
that means it can be this, but then for that you have to memorize that stuff.
Right. Right.
It's like a lot of data that you have to first download in your brain, and
Right.
then keeping that data in mind, you have to look at research ki okay theek hai, now this is this is the latest research, now
Right.
this is how you have to do it differently. I think that is a very big challenge. And like apna to the sheer number of, because of the sheer number of patients,
Mhm.
अपना ऐसा होता है कि अरे भाई इनको ट्रीट करने के लिए यू probably, I don't know, probably don't need to look at the latest data so much as perfect your own जो भी है concept level का stuff. ऐसा ऐसा मुझे
Right.
लगता है.
Mm.
I mean probably is what the difference between our practice and their practice.
The thing is, I don't really expect these changes to happen at the residency level, to be honest, because residents are just too busy, I feel, and they have a lot of work that they have to do. So तुम जो बोल रहे हो correct है absolutely कि we spent a lot of our years just trying to build concepts, but what I'm trying to say is that when you're building these concepts, instead of relying on just books, I think even if you give like 15 minutes every day to read one paper, it's not a lot to ask, to be honest. You can read one paper every 365 days, 365 papers every day. People study because one thing is they want to give an exam at the end of the day. And I feel this notion that, you should study because an exam is coming up should disappear. Like, I mean, that is my way of thinking. Second thing is that जो research है, it should become a part and parcel of your medical education.